My name is Nizama Sinanovich, and I'm a registered dental hygienist here at Timberlane Dental Group located in Vermont. Not only is this proposal an idea for offices here in Vermont, but I hope that my arguments in the next 10 minutes or so can have a positive effect in all dental offices worldwide. I would like to talk about our current techniques in the dental office and a solution to those problems that I will bring up. Our current techniques are good, but I think they could be better with the introduction of dental lasers. I have attached my PowerPoint for those who are following this web conference, and that could follow along as I explain some things. And I do have a few note cards with me to aid me along the way. The agenda will be for me to talk about the current problems with our drills and instruments and how they damage the surrounding tissue, consume more time, and cause patient fear, and just patient fear in general, and how we could save some time. My solution is dental lasers. And reintroducing dental lasers could take patients' fear away, make our procedures more efficient. That way patients can have a more comfortable experience. Most importantly, I also talk about how the dental lasers work and why is it so important that we reintroduce this concept and technique into our dental offices. Also, along with that, I will talk about a budget that I have proposed and base it on a dental office like mine, which is 10 units and 10 registered dental hygienists, and that hopefully others can take away from this and possibly reintroduce dental lasers or introduce them clearly, and that way they could have something that could base their numbers on as well. Just an idea. So first of all, I would like to talk about how our current techniques, the drills and instruments that we use, damage tissues during those techniques. Damage happens to surrounding gums and tissues in the mouth, but they're never intentional. But they do, unfortunately, often happen. But that's because the techniques that we use were the techniques that were taught, and although they are effective, they're not beneficial all the way through the future. Trauma occurs to the gums around the site of the tooth or where the treatment area is, often because we use drills that have to, for example, I will use restorative filling as a example. So when we do restorative filling, we have to use our drills and our SH67 instruments, which are very pointy and very loud, but they do get the job done. Although sometimes we have been accused of over-treating teeth. Although we treat an area, that leads us to over-treat the outside area, which intentionally didn't need to be treated at hand. But for us to get through a site for the treatment, we have to get through the tissue to the site of the origin where the problem is. So it's not our fault, but there are other techniques that could possibly avoid such procedures that cause this happening. And then with the drilling that's happening for, say, the filling, that we have to re-drill it, reshape it, refill it, bleeding often occurs. So we, as dental hygienists, need to know when we need to pre-medicate patients that have problem with bleeding, so that way they don't get infective endocarditis. Patients that we watch out for, we very well know, are patients that have artificial joints and artificial heart valves. So for them, minimizing bleeding is very, very crucial. So we need to be careful of that procedures to know that that doesn't happen again. so that they're not bleeding as much as they should. Sometimes it's hard to do that because of what the procedure requires us to, for example, putting on an amalgam crown. The surrounding gums need to be moved, that way when the crown is placed, the gums can overlap it and heal on it. That's how the amalgam can stay in place. So procedures like this take time, and we understand that. But some procedures, like the amalgam replacements or fillings, require local anesthesia so patients don't feel any pain. For some of these procedures, as we very well know, can be very painful to the gums and jaw part of the face as well. So you have one procedure that's requiring another procedure that builds up time. Patients, especially causes a concern for those patients that have fear. You're adding on the fear of the drills, and then you're adding on the fear of the needle for the anesthesia, and then you're consuming time because you have to let the anesthesia kick in. And that usually takes 10 to 15 minutes depending on what's being done, and if it's a molar tooth, it needs more time because there's more nerves in that tooth because it's a 3-rooted tooth compared to a mandibular anterior tooth that could take less time because it has one nerve pulp, so therefore. But in the overall idea of it is that it takes time. So you're adding on time, you're adding on stress possibly to patients that have the fear, and things like this could be taken care of. So our goal is to make patients very comfortable and to have a good experience with us. We don't want patients to be fearful. We don't want them to be in our chair for 2 hours. We need to look at our possibilities for solutions for that. And I am willing to argue that dental lasers could be the next solution for these problems that I just presented to you. So patients are fearful. They don't want any additional procedures like anesthesia. So what can we do? I am advocating for the solution of lasers. Lasers will reduce the need for other procedures like anesthesia. They can provide patients with comfort and reduce trauma, and as well within all that, save time for us and for the patients. And with that, we can see more patients throughout the day, and then it benefits everyone when you look at it as a whole, not only the patient in our chair. But we also want to make sure we're looking at that first. So I want to talk about a little bit how lasers work. So lasers work by emitting light, which creates energy, energy created by light that breaks up bonds at the site of the treatment, which allows things to sort of move and shift in with all respects, just like a drill would do. So for example, if we need to fix filling, that light will provide enough energy to split up the bonds that are holding that filling together inside the tooth and allowing us to reshape it without using our drill, without administering local anesthesia, without extra add-ons. And so this would be something that patients would love to hear. The way that we can tell them, the drill's going to be away, that we're using light to help you cure this problem that you're having right now. It's more easier, it creates a more relaxed atmosphere for the patients. So, like I said, the lasers that we would use, are from the AMD company, laser company, which sell Picasso brand lasers, which have like a touch screen. I have in my final report a picture of what they look like, In this PowerPoint, you can see the blue light being emitted inside the mouth. That's lasers. So overall, it's a light, which is easier to tell a patient instead of saying, we're going to be using this drill, because I think it's important that our patients know what the procedure is. That way, even though if it's not the best procedure they're going to have, it's important for us and in our code of ethics that we explain the procedure to our patients, whether that be administering local anesthesia or just having a prophylaxis done or a root canal, whatever it may be. I personally, as a dental hygienist, think that patients should know what's going on. So that's about lasers. So I have contact the AMD laser company and talked about a budget-wise example. And so the AMD laser company currently has the Picasso brand named lasers, like I just mentioned before. And for a 10-unit office like ours, we would need 5 lasers that could be shared among the 10 dental hygienists in our clinic. And I got approximate total for the total for the 10 for the 5 lasers, and it will cost around $8,036. Now, as a dental hygienist, we need to get a laser course accredited to our license to be able to provide treatment using lasers, and I think that's really important. And Vermont Technical College hosts a few times a year. They have one just coming up now soon, a dental laser course for dental hygienists to be certified in. And so with some research, I have contacted them, and for the 10 of us dental hygienists to get certified in that laser course, it's going to be approximately $1,108. And then we're looking at a total, and I have this on my screen on the PowerPoint, of $10,058.40. Now, that's within our budget. It's a little over, but the state of Vermont Board of Dental Examiners would look at this and get it approved for us, and hopefully this proposal and some support from my colleagues, and then for advocating for my patients, that we could get this approved. So in conclusion, I think that a solution to the problems that I mentioned, it could be lasers. Lasers, like I said, can improve our clinic atmosphere. Instead of hearing the noisy drills, we can see light from the dental lasers that we be using. We can decrease the risk of traumatizing or damaging the around the site of the origin where the treatment is being, like the surrounding gums and the surrounding tissues, and overall save time for everyone. So I would like to thank you for attending this webinar, for those who have did, and thank you for your time, and I hope that this proposal can be taken to the next step, and that way we could reintroduce dental lasers. Thank you so much.